Your nervous system is quietly running out of one of the most important molecules it needs to function. Not protein, not glucose, not even oxygen in the way most people think about it, but a single vitamin that your body cannot make on its own and cannot store forever. That vitamin is B12, and right now, in clinics across the UK and the US, it is being missed in millions of adults who are walking around with symptoms that look like aging, look like stress, look like depression, look like early dementia, and are actually the slow biochemical starvation of their nerves and their red blood cells. The problem with B12 deficiency is that it doesn't announce itself with one dramatic symptom. It creeps in, it mimics other conditions, it gets dismissed as getting older. And by the time someone finally tests for it properly, the damage to the spinal cord, to the peripheral nerves, to the brain can already be partially irreversible. What makes this worse is that the standard blood tests most GPs run will often come back as normal even when the deficiency is significant at the cellular level. So patients are told they're fine, their B12 is in range, go home, get some rest, try an antidepressant. Meanwhile, the actual signal their body is sending is being ignored because the test wasn't sensitive enough to catch it. There are 8 hidden signs of B12 deficiency that get missed every single day. And once you know what they are, you'll start to recognize them in yourself, in your parents, in your partner. The damage is preventable, but only if you know what you're looking at. Hi, I'm Dr. Alex. I'm an emergency medicine doctor, and after nearly 10 years in the AANDE, I've seen what happens when preventable disease isn't prevented. I've admitted patients in their 50s who couldn't feel their feet anymore, patients in their 60s brought in confused and unsteady, patients who'd been told for years that nothing was wrong with them. And in many of those cases, when we finally ran the right tests, the answer was sitting there in plain sight. A vitamin deficiency that had been quietly progressing for a decade. My goal now is to help people avoid that ending, to help you spot the early signals long before they turn into hospital admissions or permanent damage. So before we go any further, I want to make you a promise. I promise to keep creating the most helpful videos I possibly can, grounded in science and the latest research, to help you live longer and to help you prevent the diseases I see in the emergency department every single day. And all I ask in return is that you give this fairly new channel a chance and hit the subscribe button. If you get to the end of this video and you didn't think it was worth your time or you've not learned something new, then feel free to unsubscribe. No hard feelings. But if you give me your time and your attention, I'll give you everything I've learned from over a decade in medicine. So please help me out. Hit the subscribe button to help this channel reach more people like you. And let's continue with the video. Before we get to the 8 signs, we need to understand what B12 actually does in the body, because if you don't understand the mechanism, the symptoms won't make sense. B12 is what we call a cofactor, which is essentially a helper molecule that 2 specific enzymes in your body absolutely cannot work without. Those 2 enzymes are responsible for jobs so fundamental that when B12 runs low, multiple systems start failing in parallel. And that's the first thing I want you to grasp. B12 deficiency isn't one disease. It's a cluster of failures happening at once because one master ingredient is missing from the recipe. The first job B12 does is help your bone marrow build red blood cells. Every single day, your body produces around 200 billion new red blood cells to replace the old ones that have worn out. Each of those cells needs to divide properly, which means its DNA needs to copy itself accurately. B12, working alongside another vitamin called folate, is essential for that DNA synthesis step. Without enough B12, the cells can't divide normally. Instead, they grow large and clumsy and inefficient. We call this megaloblastic anemia. The cells are still being made, but they're too big, they're too few, and they don't carry oxygen properly. So your tissues, your brain, your heart, your muscles all start running on a reduced oxygen supply. And that's where a lot of the early symptoms come from. The second job B12 does is even more critical, and frankly, it's the one that causes the most lasting damage when ignored. B12 is essential for maintaining the myelin sheath. Myelin is the fatty insulation that wraps around your nerve fibers, almost exactly the way plastic insulation wraps around the copper wire in your house. Without that insulation, electrical signals can't travel cleanly. They leak, they short circuit, they slow down. When B12 runs low, your body can't maintain the myelin properly, and over months and years, the insulation starts breaking down. The nerves underneath get exposed, they misfire, and eventually, if it goes on long enough, they die. That's why B12 deficiency causes numbness, tingling, balance problems, and in severe cases, a condition called subacute combined degeneration of the spinal cord, which is exactly as serious as it sounds. Now here's where it gets really interesting and where most people get tripped up. Your body absorbs B12 through a remarkably complicated process that depends on several things working in sequence. First, you eat the B12, which is bound to animal protein in your food. Second, the acid in your stomach has to release the B12 from that protein. Third, a molecule called intrinsic factor, which is made by cells lining your stomach, has to bind to the B12 and escort it down to a very specific section of your small intestine called the terminal ileum. Fourth, the cells there have to recognize the intrinsic factor B12 complex and pull it into your bloodstream. If any one of those 4 steps fails, absorption breaks down. And in modern adults, there are dozens of reasons those steps fail. Stomach acid drops naturally with age. By the time many people are in their 60s and 70s, they're producing significantly less acid than they did at 30. That alone reduces B12 release from food. Add in the widespread use of acid-suppressing medications, the proton pump inhibitors, and the H2 blockers that millions of people take daily for reflux. And you have a population whose stomach simply can't extract B12 from meat anymore. Then there's metformin, the most commonly prescribed diabetes medication in the world, which interferes with B12 absorption in the terminal ileum. Add in conditions like celiac disease, Crohn's disease, gastric bypass surgery, and a condition called atrophic gastritis, where the stomach lining wears thin, and you start to see why B12 deficiency is so common in adults over 50, even when their diet contains plenty of B12 on paper. And there's one more piece of the puzzle that almost nobody talks about. The standard B12 blood test, called serum B12, measures total B12 floating in your bloodstream. The problem is that only about 20% of that B12 is actually active and available to your cells. The other 80% is bound to inactive carrier proteins and isn't doing anything useful. So you can have a normal serum B12 level on paper while your cells are functionally starved. The more accurate tests are called active B12, which measures only the usable form, and methylmalonic acid, or MMA, which rises when B12 is functionally low at the cellular level. Most GPs don't run those tests routinely, so the deficiency gets missed. What we're now understanding is that B12 status exists on a spectrum, not as a simple yes or no. There's a grey zone, often described as borderline or low normal, where the serum test looks fine, but the patient is symptomatic, and the active tests reveal real deficiency. That grey zone is where most of the misdiagnoses live, and it's where the 8 signs I'm about to walk you through become so important, because long before the blood test catches up, your body is sending signals. Just really quickly, if you're getting value from this video so far, please consider subscribing. It genuinely helps the channel reach more people who need this information. So let's get to the 8 hidden signs that doctors miss most often. The first sign is persistent tingling or numbness in the hands and feet, often described as pins and needles that come and go. This is one of the earliest signs of myelin breakdown in the peripheral nerves. People dismiss it as having slept on their arm, or as a circulation problem, or as something to do with their shoes. But when it's happening regularly, when it wakes you up at night, when it lingers for hours, that's the nervous system telling you the insulation on your wires is wearing thin. The second sign is a strange, unsteady feeling when you walk, particularly in the dark or with your eyes closed. We call this proprioceptive loss, which is your brain's awareness of where your limbs are in space. The nerves that carry that information run through the back of your spinal cord, and they're some of the first to be damaged when B12 falls. Patients often tell me feel like they're walking on cotton wool, or that they have to look down at their feet to know where they're going. That's not just clumsiness. That's a neurological signal that needs investigating. The third sign is a sore, smooth, or burning tongue. The medical name for this is glossitis. The cells lining your mouth and tongue divide rapidly, just like your bone marrow cells, so they need B12 to replicate properly. When B12 is low, those cells can't keep up, and the tongue can lose its normal texture and become inflamed, painful, or unusually red and shiny. People often blame it on toothpaste or on something they ate, but if your tongue feels burnt for days at a time without a clear reason, B12 belongs on the list. The fourth sign is unexplained fatigue that doesn't improve with rest. This is the one that gets dismissed more than any other because everyone's tired and everyone has a reason to be. But B12 deficiency fatigue has a specific quality. It's a deep oxygen-starved tiredness that comes from your red blood cells not delivering oxygen properly. People describe feeling winded, climbing stairs they used to take easily, or needing to sit down halfway through tasks they used to do without thinking. If your fatigue is worse than your life justifies, that's worth a closer look. The fifth sign is mood changes that look like depression but don't respond to standard treatment. B12 plays a direct role in producing neurotransmitters like serotonin and dopamine. When it runs low, mood regulation suffers. I've seen patients put on antidepressant after antidepressant for years with no real improvement, only to find their B12 was significantly low the entire time. Within weeks of correcting it, the fog lifts. That doesn't mean every case of low mood is B12, but it absolutely belongs in the workup before someone is told it's just depression. The sixth sign is memory problems and brain fog, particularly in adults over 50. This is the one that terrifies people the most because it can look like the early stages of dementia. And here's the cruel irony. B12 deficiency can cause a reversible cognitive decline that, if caught in time, responds beautifully to treatment. But if it goes on for years, the damage to the brain becomes permanent. I've had patients come through the emergency department who were being assessed for early Alzheimer's, and the answer turned out to be a vitamin level. That's how big this gap is. The seventh sign is pale or yellow tinged skin. The pallor comes from anemia. The yellow tinge, which doctors call jaundice, comes from the oversized red blood cells that B12 deficiency produces breaking down faster than they should. The byproducts of that breakdown build up in the blood and tint the skin and the whites of the eyes. People often think they look tired or hungover. They don't realize they're looking at the visible signature of a B12 problem. And the eighth sign is heart palpitations, breathlessness on mild exertion, or a fast resting heart rate. When your red blood cells aren't delivering oxygen efficiently, your heart compensates by working harder. It beats faster, it pushes more volume per minute. Patients feel their heart racing for no obvious reason, or they get short of breath walking to the kitchen, and they assume it's anxiety, or it's their age. In many cases, it's the cardiovascular consequence of an oxygen delivery problem that started in the bone marrow because B12 ran out. Now, when you see those 8 signs listed together, you might recognize 3 or 4 of them in yourself. And that recognition is the point, because individually, each one gets dismissed. Together, they tell a story. And it's a story that an active B12 test or an MMA test can confirm in a matter of days. So what do you actually do about it? I'm not advocating for extreme approaches here. I'm not telling you to start injecting yourself with vitamins or to abandon your current medical care. What I'm going to walk you through are 5 concrete actions that, taken together, address the absorption pathway, restore the cellular supply, and protect your nervous system going forward. Each of these ties directly back to the mechanism we talked about earlier. The first action is to ask your doctor for the right test. The standard serum B12 test is the bare minimum, and as I explained, it misses a huge proportion of functional deficiencies. What you want to ask for is an active B12 test, sometimes called holotranscobalamin, and a methylmalonic acid test. Together, those two tell you whether the B12 in your blood is actually getting into your cells and being used properly. If your GP isn't familiar with those tests or pushes back, you can request them privately through most major laboratories for a modest cost. This is the single highest leverage action on this list because without the right test, everything else is guesswork. The second action is to address the absorption pathway. If you're over 50, if you take acid-suppressing medication, if you take metformin, if you've had any kind of stomach or bowel surgery, or if you're on a plant-based diet, your absorption is almost certainly compromised. For most people, oral B12 supplementation in the form of methylcobalamin or hydroxycobalamin is the practical first step. The doses needed are higher than what's in a standard multivitamin, often in the range of 1,000 micrograms daily because absorption is so inefficient. Think of it like watering a garden with a leaky hose. You have to put more in at the top to get enough out at the bottom. For people with confirmed deficiency or absorption disorders, B12 injections given by a clinician bypass the gut entirely and restore levels reliably. I'm not suggesting anyone stop taking their prescribed medication without talking to their doctor. Medication and lifestyle are not mutually exclusive. They work better together. The third action is to look honestly at your diet. B12 is found almost exclusively in animal products: meat, fish, eggs, dairy. Plant foods don't contain meaningful amounts unless they've been deliberately fortified, like some breakfast cereals and plant milks. If you're eating a vegetarian or vegan diet, supplementation isn't optional, it's essential. And even for people eating plenty of animal protein, the absorption problem we talked about means that diet alone often isn't enough past a certain age. Research published in the American Journal of Clinical Nutrition has shown that adults over 60 often have markedly reduced B12 status even when their dietary intake looks adequate. The food is going in, it's just not getting absorbed. The fourth action is to support the broader B vitamin family, because B12 doesn't work alone. Folate, which is vitamin B9, works hand in hand with B12 in the DNA synthesis pathway. If folate is high but B12 is low, it can actually mask the anemia on a blood test while the neurological damage continues silently underneath. This is why supplementing folate without checking B12 status can be genuinely dangerous in older adults. The two need to be assessed and corrected together. Eating leafy greens, legumes and whole foods covers most people's folate needs, but if you're supplementing, do it knowingly and ideally under guidance. The fifth action is to protect your nerve health more broadly while you correct the deficiency. Regular movement increases blood flow to peripheral nerves and supports their repair. Adequate sleep is when the nervous system does most of its maintenance and consolidation work. Managing blood sugar matters here too, because high glucose levels independently damage peripheral nerves through a separate mechanism. And if you stack B12 deficiency on top of poorly controlled blood sugar, the nerve damage accelerates dramatically. Whole foods, regular activity, and decent sleep aren't glamorous interventions, but they're the soil in which B12 correction actually works. Without that foundation, you're trying to repair wires while the rest of the electrical system is still being damaged. Let me bring this back to the central point. B12 deficiency is a multi-step problem, which means the solution is also multi-step. You can't just take a tablet and assume it's handled. You have to confirm the deficiency with the right test, address the absorption pathway, fix the dietary supply, support the cofactors that work alongside B12, and protect the broader nervous system while repair takes place. When all five of those happen together, the recovery in many cases is extraordinary. Numbness fades, energy returns, mood stabilizes, cognitive sharpness comes back. I've watched patients in my clinic go from being convinced they were developing dementia to being completely back to themselves within 3 to 6 months of proper treatment. I want to share a few things I've seen on the front line because the numbers and the mechanisms only mean so much without the human side. I had a patient in her late 60s brought in by her daughter because she'd become unsteady on her feet and was getting confused in the evenings. The family was bracing themselves for an Alzheimer's diagnosis. We ran a broader workup than usual. Her active B12 was severely low. Within 8 weeks of starting injections, her gait improved. Within 4 months, the evening confusion was gone. Her daughter cried in the corridor when we told her the test result. Not every case ends like that. Some patients come in too late, and the spinal cord damage doesn't fully reverse, but many cases, if caught in time, do. I had a man in his 50s who'd been on metformin for nearly a decade for type 2 diabetes. He came in with palpitations and breathlessness. His ECG was unremarkable. His full blood count showed enlarged red cells. His B12 was at the very bottom of the reference range, technically normal, but his MMA was significantly elevated. He'd been functionally deficient for years, missed by every routine check, while the medication that was helping his diabetes was quietly depleting the vitamin that his nerves and his blood depended on. After supplementation, the palpitations resolved, and his energy returned to a level he hadn't felt in years. What these cases have in common is that they represent the gap between what the standard tests catch and what's actually happening at the cellular level. Research in the journal Blood has shown that as many as 1 in 6 older adults may have functional B12 deficiency that the routine serum test fails to identify. That's a remarkable number. It means in any given waiting room of patients over 60, several people are walking around with a slow biochemical drag on their nervous system that nobody is treating. And here's the bigger picture I want you to take away. The reason this matters isn't just about avoiding tingling fingers or fixing low mood. It's about what it means to live well into your 70s and 80s. The single biggest determinant of independence in later life is whether your nervous system still works, whether you can walk steadily without falling, whether your brain can still hold the thread of a conversation, whether you can drive, cook, manage your own medications, recognize your grandchildren. All of that depends on nerves and brain cells that need a steady supply of the building blocks they were designed to run on. And B12 is one of the most important of those building blocks. Letting it run down for years isn't a small thing. It's the difference between aging into your 80s with your faculties intact and aging into your 80s dependent on others for basic tasks. This isn't your fault. The system has been failing to test for it properly for decades. The medications that contribute to it are widely prescribed without warning patients about the connection. The food system has shifted in ways that make absorption harder for older adults. None of that is on you, but the knowledge of what to ask for, what to look for, and what to do about it is now yours. And once you have it, you can act on it, you can pass it to your parents, you can pass it to your partner, you can pass it to anyone in your life who's been told their fatigue or their numbness or their brain fog is just part of getting older. 8 signs: pins and needles, unsteady walking, a sore tongue, deep fatigue, mood changes that won't lift, memory and concentration problems, pale or yellow tinged skin, a racing heart or breathlessness. If you recognize 3 or more of those in yourself or in someone you love, ask for the right test: active B12 and methylmalonic acid. Don't accept normal serum B12 as the final answer if the symptoms are there. The damage is preventable, the treatment is straightforward, but only if it's caught in time. If you found this useful, please subscribe to the channel to help me reach more people.